Hi, my name is Vanessa Pexoto, and I am a grad student from NU 629, Advanced Health Promotion and Disease Prevention. And I'm here today to present my final pocket guide for family nurse practitioner clinical. That's going to be helping me during my clinicals. It's my guide where I can refer if I have any questions or anything that is related to the topics that I chose to put over here for this class. So here's the pocket guide, the final pocket guide, and I made a front page index where you're gonna find pediatrics, women's health, and adult geriatric. Under pediatrics, you have vaccines, infant feedings, developmental reflex milestones, growth chart, asthma management, pregnancy, STDs, under women's health, STDs, breast cancer, HPV, so prevention health screen for the health adult, colorectal cancer, and miscellaneous, some of the things that I thought was important and valuable to have. So to start under one, which is our vaccination, I put in some vaccination schedule so I can refer to whenever you need. So it's divided by age over here. Here is 0 from 6 years and 7 until adult age. And I also decided to put a chart, so when to give MMRs and varicella vaccination after my patient had received immunoglobulin or any blood product. And I also have a list of all the live vaccines so I can refer to. And I decided to put some pictures of some skin rash to identify rubella. And also I put it parathyroid gland swelling, how the baby or the child will look like, the face. And I have the varicella lesions as well as measles and couplet spots. So under topic 2, I have infant feedings, and I have a little chart showing me the guideline, like how many ounces supposed to receive and how many times per day, and separate for months of age. And also dietary recommendation for toddlers or early school age children's, different like protein, grains, fruits, vegetables, portions. And then under number 3, I have developmental reflex and milestones. So I have a list of the reflex, how to check for them, the age they will appear, and the age they're resolute, and the age at resolution. So the age at their appearance and the age of resolution. And I decided to put some pictures of how to check this reflex, what's normal and what's not abnormal. Common developmental milestones by age. And over here, 0 to 12 months. So cognitive, social, emotion, self-help, fine motor, and writing skills. This is from 12 to 24 months of age. And number 4, it is, let me go back to my index. It's growth chart. And under growth chart, I have international birth weight percentile chart. And here, I think was very important to put how many inches a child should grow. It is also divided by age. What's the norm? So I could check if it's, the child's underweight, overweight, is not growing properly. And this is just a little, nice thing that I made to use interpreted for the CDC growth chart. So there's little steps, and how to calculate BMI. I know everything it's on the computer. It's already like you can just plug it in, but it's nice to refer for some math and way to calculate by yourself. And number 5, it starts, I believe, no, asthma management. I decided to put that because it's pretty it's a common diagnose, especially among children. So here it's by age. So how to manage and diagnose and manage to see if it's well controlled, not well controlled, very poorly controlled, and how you're gonna step up the management of the asthma. And here, what kind of medication you're gonna be using. So all depends, step 1, step 2, step 3, step 4, step 5, step 6. Depending on your assessment, you're gonna see if you need to step up or continue with the treatment, what kind of treatment you're going to be introducing, like for instance steroids, corticosteroids, LABA, and it's by age as well. So number 6, I started women's health, and it's pregnancy. Under pregnancy I put a different topics and things that I could refer to. So I found this nice picture where it shows me the cervix and what to look for and some signs during pregnancy, Godwell, Hager signs, Chadwick signs, as well like some different difference between a person who had never had a child and then the person who had, how they look, how the cervix would look. And Nightingale rules, like I could refer back if I forgot how to do the EDD, as well as some landmark for ultrasound, early pregnancy, so you can determine the EDD. I also put a bullet points about presumption, probable, and positive signs of pregnancy. Here is the timing of tests needed during pregnancy, and it's a very nice and very visual chart where I can see the test, what it's for, and when it's done, and how it is done as well. And I also put in bullet points tests that are done early in pregnancy. A little bit about like how to interpret the glucose test. Bacterial vaginosis treatment for pregnant and non-pregnant women. And most of this information is from UpToDate database, which is a very reliable database. So I also chose to put preeclampsia diagnosis criteria. And then we're gonna jump for number 7, which is our 7 is breast cancer, HPV, and STDs. I started with breast cancer screening recommendation. And then I have factors that increase risk of breast cancer, over here listed. STD screening recommendation by age and population. And I printed this from the CDC website, which is a HPV vaccine information for clinician. It tells me a little bit about background, the disease, and when to give and not to give the vaccination. Recommendation, and yeah, that's it. And number 8, it is our adult and geriatric population, and I decided to put this as a preventive screening and guidelines for healthy adults whenever they're coming for a well visit. How what they're gonna be doing, like cancer screening, sensory screening, infection screening, vaccine immunization, and other recommendation. And this is by age, so 22 to 26, 27 to 49, 50 to 59, 60 to 64, and then 65 above, our elderly population. And here is more about colorectal cancer. And one thing is interesting is like about the grade A, B, C, D. It's over here is the USPSTF recommendation grades. risks over benefits whenever you're ordering a colorectal cancer. And 10 is miscellaneous. So I put a little bit about PD vital signs so I could refer to if I somehow forget. And also, this is just like a schedule drugs by state that as a family nurse practitioner, how I'm gonna be, or like prescribing those drugs. And I thought was very interesting is this little algorithm how to diagnose and polycystic ovary syndrome and how to treat. So I put it as the last page. And this is what I have for my pocket guide book that I'm going to be using on my clinical in the fall. Thanks for watching.